Hi, I am Dr. Banarji, shoulder surgeon. I am head of the shoulder and upper limb division, Sakra World Hospital. If a patient has a rotator cuff tear, he will complain of pain and inability to do overhead activities. Actually, rotator cuff tear can be a small tear or a bigger tear. A patient with a smaller tear will have pain in the shoulder joint, will have limited activity of movements, and will have a loss of strength. So, for say, when you examine a patient with smaller tears, when you subject them, when you ask the patient to lift the hand and give a resistance, patient will not be able to sustain that resistance. That is called a weakness of supraspinatus muscle. And the patients are asked to push the hand by the side. When you try and push the hand by the side, there will be a weakness and pain. So this is the sign of a rotator cuff tear. In a patient with a massive tear or a bigger tear, patient will not be able to lift the hand voluntarily. Okay. If somebody lifts the hand voluntarily and the hand drops down automatically, that is called drop arm sign. So these are the clinical signs of a rotator cuff tear. But for a patient to know on his own, if the patient tries to lift a small weight, say about 1 kilo or so, and lift the hand elevated above the head, and if he tries to hold it for few seconds, patient will complain of severe pain and fatigability in the shoulder joint, and the hand automatically tends to come down due to pain and weakness. This is one of the most important signs of rotator cuff disease. The other important sign is patient will have pain during the night time, which radiates up to the middle of the arm. Okay, these are the signs of rotator cuff disease.